What is going on, guys? Welcome back. Commentary for you. Amberlynn Reid, of course, has put up a video clickbaiting her health, going over the ailments she has that she's been so nonchalant about, so nondescript about for the last couple of weeks. And she starts off with a little history lesson, going over some prior symptoms, how she was dependent on trips to the emergency room other than a specialized physician. We'll get into that in just a moment. She said she went to the emergency room and they told her that because of her size, it's common for her to have irregularities in her cycle. And she said that she started to develop a fear of not wanting to go to the gyno because of this. Now, to me, it's ironic that in part that fear catered to her disillusion. She knew something was wrong. She knew her body was responding in a way that wasn't right. And she went to the emergency room hoping for a simple fix. And she didn't want to think beyond that because to Amber, if she doesn't know something's wrong, then she can pretend that nothing is wrong. Now, the emergency room likely didn't have the proper physicians to cater to this type of specific ailment, regardless of what the issue was. And I really honestly have a hard time thinking that they just sent her out of the emergency room and said, you know what? All of this is based on your weight. You don't have to follow up with anyone ever again. Everything's going to be okay. You go back to the world. To me, this is the core issue. You come online, you pretend that, doctors don't care. You pretend that medical professionals don't have your best interest in mind, but the reality is they can't care for you. The current state of Amber's health is a direct reflection of that. From what I recall, watching her during that time, she didn't go to the follow ups. She didn't stay on the medication. But now she wants to blame everyone else. And I can't stress enough that she has the time, which is the most important part, having the time, the means, and the income to give herself the flat out best care possible. She continually refuses to, be it physical, be it mental, be it diet. Because, pun fully intended, in large part, she has made a career on her size. The thumbnails, the vlogs, she does them to highlight her size. Her size has consequences, and she has had more than ample time to learn and understand them. So she brings us to present day. She's got blood in her urine. She gets scared. She starts crying. She has these flashbacks to the issues before, and she admits she went right to Dr. Google and she self diagnosed herself with a UTI. But she said she still wanted to see if she could get things addressed. So to me, she's been in Oklahoma now for I think around 8 months. She's now frantically trying to find a physician. She's awestruck that doctors have a waiting list, some of them up to a year. She then fails to understand the new patient versus returning patient concept. Doctors, dentists, they're only going to accept people they can properly care for. And being honest, from what we've seen, Amber is the worst patient you could ask for. A doctor puts a lot of time into their craft, takes a lot of education and time to get a PhD. They dedicate their life to it, essentially, but they can't make you care. Amber only cares in the face of an emergency. She can be bleeding for 2 years, little more than a second thought. But right now, she wants to sit here and proclaim, this is urgent to me now, so it needs to be urgent to everyone else now. That's why I can make content. That's why I can say I'm afraid to talk about it. That's why when I call the doctor, you need to make all these exceptions and get me in now because I, by my own thought process, am having an emergency. Whereas if you had had a doctor under their care, perhaps could have resolved whatever this ailment was long before it got to this point. She then goes into the possibility that it could be as simple as a kidney stone, as devastating as terminal. And I can't stress, those are two widely different ends of the spectrum. At this point, and this is, I think, where most people are going to be very, very frustrated, she actually comes out and says this isn't her fault. It's not her weight's fault. And we can't blame her and her weight for everything that happens. And I just want to point out, at least in part, there is some accuracy to that statement. Amber cannot manifest kidney stones. She just can't sit there and think about kidney stones enough to the point that she has them. But the sodas, the sports drinks, the buzz balls, everything other than water that she has to pound down, that will create the kidney stone. Nothing to do with her size. Now, she closes out in kind of, validating issues, respecting each other when having this conversation, and once again, trying to express that size can't be used to validate everything. And part of me can't help but think this is coming from a reading of the comment section. But when you look overall at Amber's health, whether you look at her mobility, whether you look at her inability to properly take care of herself, and she mentions a lot of that in the video. She says, because of my size, people think I don't shower. People think I don't clean. People think I can't do things for myself. Well, they're not just sitting there and saying, the stereotypical, if someone's larger, they must be lazy rhetoric. What they're saying is looking at how uncomfortable you must be at that size. It must make these mundane tasks, these normal everyday things, very challenging to the point that someone may not want to do them. That is why Amber used to come online and show herself in the shower proclaiming, look at me. Oh, are you still there? We all remember those videos because she had to prove to us that she was capable of getting in the shower. I don't think anyone questions that Amber can do what she wants to do. If she wants to go and get fast food, she'll have it delivered. If she wants to put together Legos, as she would say, all day, then she can do that. If she wants to sit here and make an excuse for every ailment and a justification for every end result, she's more than welcome to do that. And she's monetizing it all along the way. But the reality is, what we've yet to see is someone truly put their health first. And I think you have to look no further than the fact that she's been somewhere for, I'm going to be gracious, at least 6 months, and not even began to sort out a primary care physician. If she had done that when she got there, the waiting list wouldn't be an issue. Now, is she going to have to wait some time? Perhaps. But was she going to have to run to a care center, an express care? Probably not. And I just also want to mention that this is also someone that is going actively to a med spa. She's going to a med spa complaining about the cost of a basically generic Ozempic because she doesn't want to seek actual physician care that can prescribe this medication for far less. Because when she goes to those doctors, they're going to have expectations for her to stay on course so that the medication can work. They don't get paid in a doctor's office to pat you on the back and say, good job, you came in today. Now, in a med spa, you're not a patient, you're a customer. They are trying to cater to you. More importantly, they're trying to sell you more of a product, more than a doctor, maybe. So she's put herself in a situation now where she thinks she has all the right people around her, but in reality, she is a customer to them when she needs to be a patient. And she does not want to become a patient. She wants to become someone that is championed for the least effort and, in many cases, the least result, and then receive maximum sympathy for what she's going through, be that from the people she's interacting with in person or online. Love to know your thoughts on this. Appreciate you watching it. I will be back as soon as I can with more commentary.